Thank you, Mr. Speaker. And I speak as the Member of Parliament for the riding of Renfrew-Nipissing-Pembroke, home to Garrison Petawawa, training ground of the Warriors, Canada's largest army base. I'm honored to rise in this place on behalf of the women and men who serve in uniform in the Canadian Armed Forces. I appreciate the trust I've earned from our women and men in the forces. They know whenever I rise in this place to question the government, I have their backs. During question period on March 9th, 2 days before the pandemic was declared, I asked the Minister of Defence when the military hospital at Garrison Petawawa would finally be operational. Canadians were disappointed to hear the Minister of Defence refuse to own up to the most recent $247 million cut from military infrastructure funding by this Prime Minister. In the case of health services, the health and safety of our troops is at risk at the worst possible time. So I ask again, what is the minister doing about the unfinished military hospital at a time when we need it most? I'm pleased to recognize the nearly 1,700 soldiers, including those from one Canadian field hospital stationed at Garrison Petawawa, who are deployed on Operation Laser. To meet the unprecedented challenge caused by the pandemic, members of the Canadian Armed Forces have been supporting a request from civilian authorities in Quebec since April 20th and Ontario since April 28th. In Operation Laser, Canadian soldiers have been deployed to long-term care facilities to maintain staffing and help with infection control and infection prevention. They are at 25 long-term care facilities in Quebec and 5 homes in Ontario. Those numbers of deployed soldiers fluctuate as circumstances dictate. Canadians expect our soldiers to be equipped with the latest in protective gear, with the proper training, and with what Canadians expect is medical-grade protective equipment. It would appear that training and equipment has not prevented 28 soldiers serving on the front lines of the pandemic from contracting the respiratory illness. Our prayers are with each and every soldier to fully recover. The women and men of the Canadian Armed Forces put their lives on the lines to protect us every day. And at the time I asked my question, before Canada was placed in lockdown, I warned the Minister of Defence our soldiers would be getting at a heightened risk of getting sick. I warned the Prime Minister. Our soldiers need to know we have their backs with the proper resources, like a full operational hospital. In the case of the construction on the hospital in Garrison Petawawa, it's been behind 2 years. The Prime Minister is such a big fan of China. China built 2 hospitals in less than 2 weeks. Canadians have learned that 28 Canadian Armed Forces members have tested positive for the coronavirus after being deployed to long-term care homes, with 12 positives in Ontario and 16 in Quebec. That is a jump in soldiers testing positive for the virus from 5 days last week to 28 days this week. How many more years will it take the Liberal government to build just one hospital?
The Honourable Parliament Secretary to the Minister of National Defence.
Thank you very much, Mr. Speaker, and I thank my honourable colleague. In times of crisis, the Canadian Armed Forces have always been there for Canadians. At this time, Canadians and members of the forces are mourning the tragic losses of the Cyclone helicopter and the Snowbirds accidents. While these losses are painful, those who serve are continuing to step up for Canadians during the COVID-19 pandemic. Our government continues to make the necessary investments to ensure that the women and men of the Canadian Armed Forces are well supported. Et nous savons qu'aucun danger.
And we know that no danger is more present to Canadians right now than COVID-19.
Were critical in repatriating about 650 Canadians from China and Japan when COVID-19 first began to spread. La santé et la protection de...
The health and safety of all Canadians is one of the main priorities during this pandemic for the Canadian Armed Forces. And that is why they are supporting the health infrastructure in First Nations communities and are assisting vulnerable populations, Indigenous, remote, and northern populations from coast to coast.
Forces are also assisting the Public Health Agency of Canada with warehouse management of personal protective equipment and with contact tracing. Through the Canadian Armed Forces response to COVID-19, called Operation Laser, we have deployed over 1,600 members to support long-term care facilities in Quebec and Ontario. As of May 24th, 36 military personnel who were providing support in facilities in Quebec and Ontario have tested positive for COVID-19. They are putting their lives on the line. And because of that, the Chief of Defence Staff has stated to recognize this uniquely hazardous environment, hazard allowance for those directly engaged inside the facilities will be pursued. I want to assure my colleagues that prior to going in, all Canadian Armed Forces personnel have been trained in assisting long-term care residents and have been provided with personal protective equipment. Conditions at these facilities and others across the country are constantly being monitored. That said, we also have to make sure that the women and men who serve, who are protecting us and our most vulnerable, have the necessary critical health infrastructure to support them. This includes investments to modernize existing military infrastructure and to build new healthcare facilities at bases and wings across the country. That's why we continue to advance the construction of the Health Services Centre at CFB Petawawa. While the project has faced delays due to the COVID-19 pandemic, we look forward to the completion of this centre in September. De plus, nous sommes toujours en bon...
Moreover, we are on the right path to start constructing a new resource center for military families at Petawawa in order to support families.
Petawawa. We have also completed jetty upgrades. We have a new armory at Saint-Hubert Garrison, a sports center at the Saint-Jean Garrison, and we continue to modernize existing infrastructure. These investments help to ensure that the men and women in uniform have access to safe and modern facilities in which to work, train, live, and receive care. Thank you, Mr. Speaker.
The honourable member for Renfrew-Nipissing-Pembroke.
Mr. Speaker, the health of the Canadian Armed Forces is a matter of national security. When will this government start to actually realize Canadians cannot wait till the end of the 20-year time frame, not till the year 2037 set by this government to properly fund our armed forces? That includes funds to complete the hospital at Garrison Petawawa, started by our Conservative government. In January, they said it would be open in June. Now they're saying September. And it's already 2 years behind as of January. This hospital needs to get open. Why won't the Liberals do what's necessary to make it operational?